All right, welcome everybody. It is Health Talk, and we are privileged to have with us in the studio this morning Dr. Elizabeth Sue, and from Community Medical Center. We got a very important topic to talk about today. John, good morning.
Hey, good morning, Peter. How are you doing?
I'm doing groovily. Thank you very much. And Dr. Sue, this rhymes. How are you, Dr.
I'm
Sue?
very good. Thank
I
you.
feel like I'm reading a Dr. Seuss book here.
Now we can continue.
Absolutely. All right. So now you've got something very special coming up that Community Medical Center is, putting forth. What is it? Where is it? What's it all about?
So with the Missoula Chamber of Commerce and Community Medical Center, we're going to be hosting on campus at the Cancer Care and Prevention Center a HealthWise fair. And this is usually, it used to be at the mall, so we're trying to make sure everybody knows of the location. For the last 2 years, it's been on our campus. And we're basically sponsoring being proactive in your healthcare. So we're going to be talking about and visiting with people about preventative lines of medicine, preventative healthcare, screening, genetic testing, cancer screening for breast and lung, colon as well, and also offer lab tests if they like to have them draw for a very low fee.
Oh, that's great.
So when you talk about the low fee and all these other services, is it a special discount just for this particular event, or?
Yes, it's a special discount, and no insurance required. We do require that patients and people all 12-hour fast prior to coming in, because we will be offering some cholesterol screening. So like general health screens will be $20, lipid and glucose checks will be $10, and vitamin D tests will be $20.
And those things are usually over $100, right?
They are, and insurance will typically cover those lab tests, but they usually have to be ordered by a primary care physician. Now, a lot of these people that come in don't necessarily have primary care providers that are their regular physician. So we do offer referrals for that, and we try to set them up so that they'll have preventative medicine, good health care throughout the year.
Okay, since I'm the designated silly question asker in the group, I always am. So if you could just describe what each of these tests is for.
So most of it is we're trying to, Community Medical Center has expanded their cancer care services to include prevention and preventative health. So our project this year is really to get the word out about preventative medicine, genetic testing, who's at risk for cancer, and do proper screening. So we're kind of the place to call if you want to be proactive in your healthcare, and also offer a lot of referral for continued medicine.
Are all these tests to do with cancer prevention, or are there other things?
No, they're all to do with preventative health, so trying to be a healthier you. So typically cholesterol, hemogram, basically, are you anemic? Check your cholesterol level. And we also will have other services there that will help, dietitian, nutrition services, balance testing. We're really looking at just everyday health for those people.
So this is a really good event for those that haven't checked in for a while. People that might be off the radar when it comes to health checks and want to know where they kind of sit.
Yes, and I would encourage, if you don't have a primary care doctor, let us help you. Come in, get your lab tests drawn for a very low fee. We'll have multiple pods set up for different service lines that we provide, including, like I said, breast cancer, high-risk screening, genetic testing, lung cancer screening, body mass index, balance testing, nutrition, health and wellness, disease prevention, diabetes and heart disease prevention.
Now, forgive my question here. Why the balance test? What's going on with that?
Says the guy who fell off the ladder.
Yeah, exactly. It was a ladder's fault.
It's good to get balance testing.
I'm a victim here. Go ahead. I'm sorry.
Unfortunately, as we get older, I think that I don't mean I don't mean that old, but I mean, I even have balance testing issues. I notice my balance isn't as good as when I was younger. So it's all about understanding how your body changes and how we can adapt and improve how we do things in a healthier way and safely.
So on the balance test, are we going to have one of those little things with a ball with a board on top, and you kind of do this whole thing?
Well, I'm not sure about that, but it is a 40-second balance test.
Really?
And it is going to be provided by the physical therapist. So I hear that it's going to be quite involved and accurate and
probably
fun.
pretty entertaining too.
Hopefully not.
Are there seats to watch?
Yeah.
Now, this could be a moneymaker. If you were to get various folks like the mayor, the city councilors, and the county commissioners, and all those folks, the people that are very, very visible in the community, have them do the balance test. That'd be kind of fun to charge admission for, and then they'd probably do it if it's for a good cause.
Well, everybody that comes can watch.
Yeah.
So.
So, how many people end up coming to these each year, do you think?
We're expecting about 250. So we're going to accommodate for a lot higher because in the past years we've had good responses. We want to encourage everybody to know about it and know about where it's going to be hosted, and it'll be on the campus. And when people come in for their lab test, they have to fast for 12 hours.
Right.
It starts at 7 a.m. and goes to 11 a.m., so you don't have to starve all morning. But we will also provide refreshments and food afterwards. So we're really excited about having this, and it's on January 21st on Saturday.
Wonderful. We're going to take a little break. 721-1290 is our number. If you have a question for Dr. Elizabeth Sue, joining us here in the studio from Community Medical Center, give us a call. All 4 of our lines are open at 721-1290, and Health Talk will continue right after this. Hey, welcome back to Health Talk. I'm Peter Christian with the fabulous John King over there, joining us the equally, probably even more fabulous, Dr. Elizabeth Sue from Community Medical Center.
Much more fabulous.
In the fabulous meter. So go ahead. What do you got?
So I did my once every 5 years medical checkup this year, actually.
Whether you need it or not.
Congratulations.
Because my wife is in the medical field, and she's like, John, get on this now. So I go in, and they were going to do some labs for me, and I had to do the fasting thing. And I still haven't gone back and got my labs yet because I keep forgetting to do the fasting thing. When I think about going and getting the labs done, I haven't starved myself for 12 hours. Well, why do you have to do that?
Well, sometimes, especially if you take anything with carbohydrates, sugar, all of that, these tests won't necessarily be really valid.
Does that include Cheetos and Dr. Pepper?
Yes, it does.
Okay.
But you can have a drink of water. You can take your routine medicines that morning. But that's another reason why we have it so early, so that people don't have to wait all day. And it is difficult to remember to fast.
I always thought the sugar in Dr. Pepper didn't count because it had the word doctor on it.
That's right. That's
not true.
That's why I drink it.
Not so true.
So it can offset the study results,
It
basically.
can. And so you can get false elevations, especially cholesterol and those lipids and so forth. But, in general, if you want a really accurate check, you're going to put a little bit of money forward to doing it. You're going to get a good health screen. Might as well come in fasting and get an accurate value so you don't have to repeat it.
So a lot of this screening stuff, getting stuff checked out early, as it can be a lifesaver. I'm sure you've, as a doctor, come into many situations where it's been a life-saving preventative measure.
Yes.
I was hoping you kind of tell us what some of those experiences are like.
Yeah, well, most of my experiences with breast cancer and sometimes colon cancer, but a lot of it is finding a problem, a cancer early, and those people are highly curable for their lifetime and may not warrant any really advanced therapies like chemotherapy and so forth. So early detection is important, but also just in preventative medicine, what can you do so that what if you're at risk at diabetes, high blood pressure, heart disease? What are some life-changing maneuvers you can take to really minimize that risk?
In other words, before you get the diagnosis.
Absolutely.
Right?
Yeah. And even if you have that diagnosis, how can we improve on that? There are ways that we can improve someone's status as far as their high blood sugars and so forth. And it's important to meet with dietary, nutrition, and we're going to have all those services available. So if someone also needs some fine-tuning or a little extra help this year to try to, I want to get more on track with to improve my health, this is the place to come.
So, Dr. Sue, let's talk about the age ranges where these tests are really important. Let's start with breast cancer.
So for breast cancer, I usually recommend screening mammograms and good clinical breast exams starting at age 40. If you have a first-degree relative that has had breast cancer, we typically start at age 35 for that evaluation. As far as other like lung cancer screening, those things that come into play are smoking history, family history, colon cancer as well. By age 50, we're usually recommending screening colonoscopies. Most people don't get around to that till 50 is sort of the marker to start, and then they kind of figure out when they're going to do it.
It needs a lot of motivation.
Yeah.
Right.
There is particular tests, however, that are coming out, like fit testing, where we're checking stools sequentially to see if there's any blood that you can't visualize that can maybe be an early detection modality. And so we're really trying to push that. If you have blood in your stools, why do you want to rule out a small tumor or cancer?
Wow. So obviously there's lots of tests for people that have been off the grid when it comes to medical care, like myself.
And me.
Yeah. What are some of the things that you say, it's been 5 years, you definitely need to do these things?
So I think that it's been 5 years. Of course, it's dependent on age and your health and different lifestyle factors. But this is a good place to start. I think that if you come in, we have multiple service lines available to talk to you. And, we're willing to sort of say, hey, if you want to be proactive about your health, how can we help you modify your lifestyle to improve that? Or are you at risk? And, this may just be the very beginning of that, consultation. However, we're able to direct patients and people in the right way.
So something as simple as weight loss, is that something that we should show up for this and just to find out if we need to lose weight?
Yes, absolutely, because I think, we'll be doing body mass index calculations, and a lot of times losing weight, risk of diabetes, hypertension, heart disease, a lot of those things, as well as lack of sleep, can be all related to developing those conditions.
Lack of sleep.
Peter famously does not sleep. It's kind of vampiric.
I'm a vampire. But
so am I.
So tell us about your work as the head of oncology at Community Medical Center.
Well, my title is medical director, and we
Okay.
just the medical director of the Community Cancer Care and Prevention Center.
Okay.
So, Community Medical Center, we just got the sign up at the last week of December. But they have agreed to sort of expand their service lines to include prevention, because that's what it's all about. We know where to take care of patients that have cancer and need cancer treatment, but what can we do as individuals to avoid that diagnosis or potentially catch it early so that we don't have to require a lot of therapies?
Sure. At what point do you become the good angel on the shoulder, whispering in people's ears, saying, "Don't eat that, don't drink that, come on"?
Well, I think this is a voluntary health fair, and so a lot of times people kind of in the back of their mind sort of have this, this year, what a great time to do it, January, New Year's resolutions. This year I'm going to be a better me, and I'm going to be healthier, but they don't know how to go about who to ask.
I've decided to be a younger me. So, does that work?
I'm not sure we can help you with that on that Saturday, but
well, the earlier the better.
Yeah.
Okay, yeah.
Yeah, you want to get that one done early.
Yeah, absolutely.
Doing it later doesn't help at all. When it comes to the preventative care, the oncology, is that where the HealthWise event will be staged, or is it all over the campus? Or
it's actually in our building, which is self-standing, and it's on the very far west side of the campus, right next to the soccer fields. And it's going to be in the building that's called Community Cancer Care and Prevention. And it'll be start in the lobby, and then, like I said, there'll be multiple pods. So you have to wait in line to get your blood drawn, but there'll be multiple pods to be visiting while you're in line. So we'll keep you entertained.
So the smart people, the people that have done this every year, where do they go first?
Well, typically,
The veterans,
from what
yeah.
I've heard, there's usually a line
Yeah.
starting before 7 a.m.
Really?
But once we let you in, like I said, we'll keep you entertained with all our different pods. There'll definitely be some swag to take home.
Some swag. A swag bag.
Yeah.
Is there a line in 10 below weather?
Don't know if it's been 10 below for any of these, but people are pretty motivated that this is their health care for the year
Well,
and to get those tests.
especially when you get the bill for the standard testing on a normal basis, $20. Are you kidding? I'm there.
Absolutely. And a lot of patients, don't be worried about coming in and saying, well, I don't know what these values mean.
Right.
We will have referrals to primary care physicians and so forth, and people to maybe answer those questions. We won't necessarily, we may not have lab values really quickly, but we have people that we can refer to if you need primary care for this year.
Well, especially if you come in, you get your blood pressure checked. That's instantaneous.
Correct.
You're like, your blood pressure is 5,000 over 280. Probably you've got a problem here.
Yeah, and that might instigate a follow-up check,
Right.
But we're sort of we're the center and the we're all about prevention, and we're all about helping you get to where you want to be.
So what about the transition to more long-term care? Let's say you find out something in the blood test, it comes back. Obviously, the HealthWise fair will probably be over. It takes a couple days for that to come back.
Yes.
Is there going to be a doctor to explain what's on there for me? And then if I need help, is there more connection afterwards?
Yes, and so we are going to try to, people that don't have primary care providers, try to set them up so that those values can be explained to them. Also, let's say you leave and then a question comes up or a value comes up and you're like, well, I don't really know who to call. And in those situations, then you can always call us. We will set you straight. We'll set you on the path of where you need to be and who you need to see.
Wonderful. All right, we're going to come right back. Again, our lines are open. If you have a question for Dr. Elizabeth Sue from Community Medical Center, give us a call. If you can slip and slide to the phone, our number is 721-1290. We're coming right back. Okay, we are back on Health Talk here on KGVO, 1290 AM, 98.3 and 101.5 FM. Dr. Elizabeth Sue joining us from Community Medical Center.
Yeah, right. We were just talking about the HealthWise program. It's coming up January 21st, right?
Saturday.
Correct.
Which is a Saturday. If you're going to get your blood tested, you need to not eat, to fast for 12 hours before you get there, and it opens at 7.
It opens at 7. And you can take your regular routine meds if you are on medications with a small sip of water.
Before we run out of time, I was hoping you could go through again some of the tests that are involved. We talked about the blood testing, and we talked a little bit about the balance test. Well, what are some of the other things included here?
So we'll have a pod also set up for high-risk breast cancer screening and genetic screening, just to see which people are at risk. So it's all about knowing your risk. We'll also have body mass index calculations, so weight, height, where's your ideal body weight. We'll have a dietitian there talking about nutrition.
Could I be taller?
That I don't know.
I'm sorry, Peter, you're too short. Get out of
Not
here.
your dreaming weight. Right.
And we'll also have people there talking about primary care, women's care, prevention lines, diabetes and heart disease, education and prevention also.
Now, obviously, you're going to have special speakers there. You mentioned it at the different pods, right? It isn't you don't just stand there, wait in line, and tap your foot.
Correct.
There are people visiting with you.
Absolutely. So we're going to strategically place the pods within the line. And so you do a full sort of semicircle around the cancer center and prevention area and then meet with everyone. So you'll have an opportunity. Also, if you visit all the pods, you get a card, you have them stamped, and at the end there will be a drawing for $50 gift cards.
Wow.
Well, for what?
For
Just something. Dr. Pepper and Cheetos.
$50, that's something.
It doesn't matter. $50 is $50. No, seriously, it's wonderful. It's wonderful.
Yeah.
Now, how long has this been going on?
It's been going on for 7 years or
7
so,
years,
and
okay.
we've had it at the Cancer Care and Prevention building for 2 years.
Right.
And then it's been in the mall previous to that.
No, the mall is, there are also a lot of constructions going on, so it's probably more convenient to have. And, of course, you guys are right at home there
Yeah.
in your own cancer center.
And we have a great facility. It's beautiful. It's also very roomy and spacious, and I think it's very inviting. So
When my wife and I would take walks around the track before they closed it down for all the remodeling there, we would walk past the back entrance to the cancer center with a beautiful sitting area and
Oh, sure.
plants. It's gorgeous.
yes.
And, of course, we kind of peek in the windows. And, it's just beautiful there.
Yeah. And the best thing is the parking's going to be easy. It's right up front, and so you don't have to search for parking. So it should be really easy for everyone.
Okay, give us again the when and the where and the how much.
It's January 21st, Saturday, starting at 7 a.m. to 11 a.m., and it's at Community Cancer Care and Prevention Center on the Community Medical Center campus.
Okay, now, real quickly, if someone wants to visit to find out more about the Cancer Center and specifically visit with you, what's the contact number and website and things like that?
Well, just remember one phone number, and we can get all your questions answered, and that's 327-3943.
Okay.
Anybody can call if you have a question, anxiety about any risk, high risk, want to know your risk. Just call us, and we'll set you on your way.
Dr. Elizabeth Sue, always a pleasure, ma'am. Thank you.
Thank you.
Thanks for being with us. All right. And that's going to do it for Health Talk. We have an hour's worth of open phones on the way with Talkback, and lots going on. The Golden Globes last night, lots of slapping around with President-elect Trump. And
I heard you also found the law when it comes to the left-hand driving lane.
Certainly did. So stay with us. We're going to come right back.